Hey there. It's good to see you. Do you mind telling us who you are to start?
Sure. I'm Joe Amon. I'm the Director of Global Health and a professor at the Drexel University Dornsife School of Public Health.
I think COVID has affected kind of everybody personally, but you're in a different part of the country. And I just wondered if you could say a little bit about how COVID has affected you personally.
I live outside of Philadelphia. In many ways, I feel remarkably fortunate and privileged. I have managed to shelter in my home for the most part. I haven't been forced to go out into the world that much, which is both a good thing in terms of protecting yourself from COVID, but also sometimes very isolating. And there's been a lot that's been, a little bit harder than usual, but there's also been a lot where it's very hard to kind of complain in the face of, seeing how hard so many communities have been hit with COVID.
So, what about for the issues that you work on, and in terms of the issues, in terms of the communities that you work with, like kind of what's your sense in terms of how COVID has or is impacting kind of the stuff that you're really engaged with?
Yeah, so some of it got sort of just put on hold. I was doing some work with the Global Fund on HIV, TB, human rights issues. A lot of the countries were moving drastically away from some programs to either find ways to adapt and continue or to address COVID within their communities. And it felt very challenging to kind of jump in and try and do anything amidst like everything that was going on. But I did kind of take a moment and think at the start of this pandemic, sort of, where are the areas that I can provide some support, some work, what can I do related to COVID? And so there were a few different things I did. One, locally, I was basically joined the advisory committee for a school to answer their questions with my background as an epidemiologist about COVID, about what we're safe, how to get kids back into schools. I also was referred to the ACLU and did work on, I don't know, maybe 24 cases on detention and COVID, particularly around immigration detention centers in the US, probably 10 different states. To me, that was fascinating from the perspective of really trying to understand a very specific population, a very specific risk. Also being able to see, discovery documents and look at what kinds of specific policies, what kind of data was being collected in those settings, often terrible policies, lack of clear policies, lack of sensible strategies for testing, for example. And then another thing I did was I increased the work that I've been doing with Human Rights Watch as a technical advisor, reviewing their documents, answering their questions as researchers who were non-health experts, but were country researchers, were trying to grapple and understand whether the kinds of policies and programs and actions that different governments around the world were taking, and to what extent they constituted reasonable approaches, rational approaches, or rights violating approaches.
Totally hear you. And I guess let's move to policies then. And if you could talk a little bit because of what you've seen, what do you think are some of the policies that we should really be thinking about that are most of concern?
To me, at the stage that we're at now, key issues is vaccines and also starting to anticipate that there's going to be a lot of lessons learned documents and how much they are going to recognize the issues of accountability, the issues of community engagement, the issues of human rights as central to an effective response and the failures therein in so many countries in ensuring that. There's a lot of different things right now that we still need to do in terms of making sure that there's vaccine equity in particular across different kinds of communities to address sort of hesitancy to think ahead at like communications and implementation infrastructure to really not just sort of declare victory because we've reached the easiest to reach and we move on as usual.
I think, do you think it's going to impact your way of thinking about work going forward?
In some regards, I mean, I think that to me, there are still, COVID related projects that I want to work on and learn from, how different countries have engaged. I mean, I think around, one issue I've worked on a lot is persons who use drugs. And there have been some really positive ways in which harm reduction organizations have responded, have found flexibility in policies and laws to better serve populations that are under lockdown. There's also been horrendous abuses that have taken place targeting that community. And so I think that those need to kind of come out and, be documented and revealed.
100%, 100%. I totally hear you. I mean, you were starting to talk in the context of harm reduction of some good examples of some things that have happened. And I wondered if you could say anything, if there's any other good examples that you've seen that governments have done, the UN has done, civil society as well, but really I was thinking more governments in the UN in terms of to address COVID, its consequences. Again, anything that we can take as something to kind of look to as something that we want to engage.
You mentioned the UN. I would say that right off the bat, I thought that the UN Secretary General's human rights and COVID report was well done. It was a shame that it didn't have more legs and kind of infuse all of the affiliated, UN agencies, but it really set out a lot of, critical markers and standards. And so, I think that is something. Most of the other positive stories, I guess, that I've seen really have been at the community level with organizations that are figuring out ways to maintain contact with populations during lockdown, for example, or facilitate easier access to services, which may continue in a really positive way. And some of that's using digital technologies, right? In a positive and empowering way and not in a kind of tracking, big government kind of way. Hopefully we'll see more and more of those being written up and being shared.
Can you say anything more in terms of kind of at the community level, some things that you've seen that you think are really positive?
Yeah, I mean, if you take a look at some of the groups working with LGBT communities around HIV access, for example, they've had to fight a lot of stigma. They've had to fight transphobia, homophobia. Adding to that, COVID and the challenges there, I think, there are examples from Uganda, from Jamaica, from Southern Africa, where they've navigated those challenges and connected people and made sure that people continue to have access to their medicines, made sure that they were able to get people to facilities when they needed to safely and those kinds of things. As I'm talking to you, I'm also sort of asking myself, am I being too optimistic? Am I grasping at optimism amidst, all of the challenges that we've faced and the traumas we faced over the past year? Because I think to some extent, yes, it's, I feel like I'm giving you a few breadcrumbs of positive stories because we need those breadcrumbs.
And I guess my last question is just kind of pulling back a little bit, which is, I mean, this has been quite a year for us all. And I just think, what do you think that as a society, what are some of the most important lessons that you think we've got globally in terms of what we should take out of our experience of this past year? What are some lessons we need to keep in mind as we move forward, whether in the immediate, but also just thinking in the long term for those of us that really care about health and rights issues?
I mean, at the very start of this, we already know from what little we've seen in China that certain populations are going to be hit hard. Some of those populations we're going to prioritize, and other populations, including people in prison and detention centers, we're not going to prioritize. And to me, we knew that from the beginning, and choices were made, specific choices were made about who we were going to protect. And I think we have to keep saying that, because there's a sense that, we learned and the science behind COVID changed and we got a better understanding of it and then we reacted to it. And it's like, no, from the very first, we knew that this wasn't going to affect everyone equally, and we were fine with that. And that has to, we have to be very clear about that, and we have to be very clear that that's wrong. And I think one of the ways to address that going forward is to really put a lot more money in public health. County level health departments know populations, they have connections to communities. And if they're gutted by lack of funding, those connections are lost, that sense of trust is lost. So there's a whole bunch of things about creativity, out of the box thinking, kind of that didn't get employed here because the people those solutions were for weren't really being given the attention and given the priorities. And the people who had the ideas were the people that really knew the community and knew how to make that work, weren't being given the platform.
Right, I hear you, and I think that's the kind of lessons that we need to make sure we keep everybody paying attention to, right? Yeah, absolutely. And again, just to say, just in kind of closing, is like it's also lessons that we learned through HIV. It's lessons that we've learned again and again and again, but we're not the ones that need to hear those lessons. It's government officials, it's the people who are the ones who are making.
Frustrated that the CDC was not given any voice, right? I mean, they were told to not do any press conferences. One of the real problems is you need a public health infrastructure that's going to be strong and independent and unafraid to really speak out and have that trust and authority.
It's kind of a perfect message to kind of end this conversation. And so thank you.
Great, it's my pleasure.